Okay, we're going to start on the chapter on sexuality. We're going to look at the sexual development and how they respond with aging and chronic illness. I have two great articles out there for you. We have to look at the physical changes of the body. We have to look at policies that in a long-term care setting that people have legal rights. And we're going to look at some strategies when people are sexually inappropriate. We have some terms that we need to worry about. As you see, really it is again about that body, the drying out, the inability for maintaining an erection, the difference between sexual intimacy, sexuality. But what we want to do is enhance sexual intimacy. It is seen as separate from healthcare concerns and really just part of the quality of life. I think the biggest barrier is that people are very uncomfortable talking about it. This is just not something we normally talk about. If you remember the first time you were a nurse or working with certain clients that you've come across, maybe because of who they are in the community, and you've had to ask them if they had a bowel movement, and that can just be just mortifying. To talk about someone's sexual needs can be very uncomfortable, but if working with the geriatric population of those 65 and older, it is something you need to be able to discuss. Again, it's about health promotion and really want to make sure people are having good sexual relationships, and if they are interested in sex, that we are doing what we can to make sure that they can function properly. ARP did a study. I think this is kind of old, but they're saying that it's still an essential part of life over the age of 45. I'll argue that and say it's an essential part of life over the age 65. Looking that people that will talk about it are having satisfaction with their personal relationships and their sexual activity, regardless of gender, marital status, and education. And that brings up a point. We have to be sensitive to the lesbian, gay, and transgender society as well. I think when you look at some of these elders that we're taking care of, they've been in a romantic relationship for 50 years, and they are just as loving, probably more loving now in their later years than they were in their younger years. Again, those that were workaholics, finding that intimacy again with their partner. And I think one of the things that we've got to really think about is what happens when that person's spouse has died. I think we don't look at that whole person. You need to think of some elder relationships that you've seen, and they still hold hands and they gaze lovingly at each other and they have endearing words. And then what happens when that person is gone? That is a big hole left. Not only have they lost the person, they've lost that intimacy as well. Adults continue to develop sexually throughout their lives. And the thing is, and in that article I have out there for you, talks about how chronic illnesses can affect the sexual function, and as nurses, what are we to do to help improve it? Now, people that are 65 and older, we're told you do not talk about sex, you do not do public displays of affection. And nowadays, we have TVs for condom commercials, for gosh sakes, which, the environment has changed how we look and talk about things. So we also have to be sensitive that they may be very uncomfortable with talking about it as well. And you're going to have some people that'll just never talk about it. And then the more you work with gerontology and in couples in this age group, the more you will. It's very much, they still want to dress up and look pretty and smell good and snuggle, and that's important. We call it a triphasic human response and changes with aging. The desire is still there. The excitement may take longer, and it may take longer to reach that orgasm. We call that a normal consequence of aging, and couples react differently to it. Maybe they are just, comfortable with the cuddling, or others are going to take Viagra. It's just who is that couple. The biggest problems then are with vaginal dryness and erectile dysfunction, um, and the things that can inhibit and have problems or that can improve it. So again, once you've had the discussion and if there is an interest, what can we do to help with the vaginal dryness and erectile dysfunction? And there's wonderful over-the-counters as well as prescription medications to help this. I think what we have to look at is, how is it tiring? Does it hurt? What may have once been seen as a nighttime activity may have to come during the day. They do know that endorphins are released during sex and may help with pain. Have to talk about new positions, maybe less strenuous work on the heart, and talk about where different positions will take that stress off. We also have to consider in that long-term care facility, they're in a single bed. When are they ever allowed time alone or a lock on a door? And caring for the ages. They do have guidelines for long-term care facilities to work with them because, again, they do recognize this as being a very important part of working with the elders. The thing is sometimes disease processes trigger sexually inappropriate behavior, and it's usually a cognitive impairment. And we need to stop the behavior, but that person still has to be maintained with dignity. You can't do that out here. Let me move you to another room. It's not okay to touch other people. Redirecting that that verbiage isn't what I don't want to hear that right now. But again, it's working with each individually and respecting their dignity. So as we wrap up this, again, there are many topics. I have articles out there for you that are evidence-based practice. And again, we need to look at more of that intimacy and what is needed and what can we help to do to promote that part of a human being.